A community-wide effort to cut sugary drink intake does not need to be abstract, punitive, or slow-moving. In fact, the strongest evidence suggests that when practical tools are combined into a coordinated, time-limited plan, meaningful change can occur within a single year. The key insight from successful municipalities around the world is that sugary drink consumption is shaped less by individual willpower than by the environment people move through every day. Prices, availability, defaults in schools, marketing cues, and social norms quietly guide behavior, and when these levers are adjusted together, consumption patterns begin to shift in a predictable and measurable way. A 12-month intervention works best when it starts with clear baselines and achievable targets rather than sweeping moral messages. Measuring current liters of sugary drinks sold per capita, mapping where children and adolescents are most exposed, and identifying the highest volume retail channels allows communities to focus effort where it matters most. From there, early policy signals set the tone. Even modest excise taxes or price levies, when announced with a public health rationale and earmarked for community programs, consistently reduce purchases while increasing acceptance over time. Importantly, taxes work less as punishment and more as a quiet nudge, making water, unsweetened tea, and milk the easier default choice. Schools are often the fastest and most visible win. Removing sugar-sweetened beverages from cafeterias, vending machines, and school events sends a clear, protective signal without requiring constant enforcement. Pairing these changes with appealing alternatives, chilled water stations, fruit-infused water, or unsweetened dairy options, prevents backlash and reinforces the idea that the goal is better choices, not restriction for its own sake. When school policies are adopted early in the year, compliance rates tend to rise quickly, and parents often report spillover effects at home as children recalibrate what feels normal to drink. Retail and marketing environments form the next layer of influence. Voluntary or incentivized agreements with local retailers to reduce prominent placement of sugary drinks at checkouts, increase shelf space for low and no sugar options, and display clear price labels can significantly alter purchasing patterns without harming overall sales. Evidence shows that retailers often benefit from clearer product segmentation and higher margins on healthier beverages. Over several months, retailer compliance becomes one of the most reliable indicators that the intervention is taking hold beyond government buildings and schools. Education and communication work best when they reinforce these environmental changes rather than carry the entire burden. Short, repeated messages explaining why the community is acting, linking sugary drink reduction to dental health, diabetes prevention, and household cost savings, build trust and reduce resistance. The most effective campaigns avoid shaming and instead highlight progress, such as liters of sugar avoided or funds reinvested into parks, sports, or school meals. This positive framing helps residents see themselves as participants in a shared project rather than targets of regulation. Throughout the year, monitoring keeps the program adaptive and credible. Tracking key indicators such as per capita sales data, school policy uptake, and retailer participation allows leaders to adjust tactics in real time. A simple dashboard that is updated quarterly can show whether consumption is trending downward and which neighborhoods or age groups need additional support. Many communities that follow this approach see reductions of 10 to 25% in sugary drink sales within 12 months, alongside early improvements in dental visits and weight-related risk markers. The most encouraging lesson from this playbook is that no single measure has to be perfect. The power lies in coordination. When policy, schools, retail practices, and education move in the same direction, each component amplifies the others. By the end of a year, sugary drinks are not banned, but they are less visible, less promoted, and less central to daily routines. That shift, modest as it may seem, translates into real health gains over time. Ultimately, a 12-month blueprint to curb sugary drink harm is not about control, but about design. Communities that succeed redesign their food and drink environments so that healthier choices become the default and sugary drinks gradually lose their cultural and commercial dominance. The positive takeaway is clear. With planning, transparency, and cooperation, municipalities can achieve measurable declines in consumption and lay the foundation for long-term reductions in diet-related disease, all within a single, focused year.